World Down Syndrome Day took place on the 21st of March, and many of us will have celebrated, I suppose, in all our constituencies, the wonderful celebration of music and dance. There were performance and celebrating World Down Syndrome Day, and I know I was very fortunate to attend a wonderful event in the Sligo Town Hall. But when I was there, I spoke with the mother of a young person, Constance. Constance is now aged 20 and has Down syndrome. Constance has always been a very bright and enthusiastic child who's made really good and consistent progress in her development, mastery and life skills. Then about 18 months ago, Constance's progress slowed and then actually started to reverse. The loss of previously acquired developmental skills in an individual, such as toileting skills, eating independently and dressing oneself, is known as regression, and is naturally frightening and worrying for both the individual and their family. Constance then also developed behaviours which were not characteristic of her personality at all. Constance has always been a gentle, sociable and loving young woman, but suddenly she became withdrawn from her friendship group and peers, and has an inexplicable outburst of anger and uncontrolled, inappropriate laughter. Assessments and interventions followed from diverse health and social care professionals and therapists, physiotherapists, speech and language therapists, behaviour and occupational therapists, along with psychology and education services, all trying to help Constance's family to understand what was going on. So there are a range of diagnoses which could have explained the deterioration in Constance's quality of life. One as such is Down Syndrome Regression Disorder, which is an autoimmune disease caused by the body's response to something, perhaps an infection. People with Down syndrome, as most of us know here, have an additional chromosome, and this particular chromosome, chromosome 21, seems to increase the frequency of autoimmune diseases, infections and brain or neurological disorders. An analogy which has been used to help me understand it is that while most of us have a hearing aid listening to what is going on in our body, people with Down syndrome have a satellite dish, so the body's response to a simple infection can be completely overwhelming. So there are other similar conditions, including Down syndrome disintegrative disorder and paediatric acute onset neuropsychiatric syndrome, which is known as PANS. Also, there are a number of other conditions. Some of the symptoms can be mirrored in each other, and sometimes these behaviours may be also confused with autism. So I suppose if the cause of the condition varies, so does the treatment and the pathway to recovery. Currently, as testing is determined by the observation of symptoms, a treatment for one condition may be trialled while the individual is undergoing other treatments and other testing for another condition. But I suppose the crux of the whole matter, it's making it very confusing, is that the recovery, I suppose, with the right treatment is possible for this. It's crucial, though, to get an accurate diagnosis and to get the diagnosis in a timely manner. 18 months on from the onset of her symptoms, Constance is still undergoing assessment under the leadership of an advanced nurse practitioner. This matters because treatment during the first 2 years of the onset of symptoms has been shown to have a dramatic and positive outcome under the impact on the outcome for the person with Down syndrome. I suppose, could you imagine any person with a learning delay or disability, if any person, if it was to display symptoms, so suddenly not being able to toilet or dress themselves and bursting into these uncontrollable fits of laughter, none of us we wouldn't be left expected to wait for 18 months not knowing what's going on. So I think what we should, how can we approach this is that's what I'm urging, is that that can tie in with the proper assessment and diagnosis of this under the Equal Status Act and Article 25 of the United Convention on Rights of People with Disabilities. How can they should have equal access to healthcare and appropriate treatment, I suppose, in diagnostic and treatment. So it's not a criticism of the excellent staff who've helped Constance, but something is wrong, and the system, we need to equip medical professionals to work with families in promptly recognising that there is an issue with a child or young person's development, and then swiftly move on to assessment, diagnosis and treatment. So I know I'm running out of time, but I suppose what I'm calling is for the Minister to work with the HSE and work with the Minister for Health to set up a task force and to take in a number of different professionals together to look at this Down syndrome regression disorder. Since I brought this up, I know you're giving me extra time, but since I brought this up, other concerned parents have contacted me this as well. There's not enough research done about it, and while the task force is being set up, if possible, there is treatment available in other countries, and could people that are displaying these symptoms of Down syndrome regression, that they can be directed to proper treatments in other jurisdictions that aren't ours. Thank you. So sorry for going over time.
Thank you very much, Senator, for raising this important issue and for offering me the opportunity to respond. The government is committed to advancing the rights and improving the lives of people with disabilities. So we're working towards the vision of the United Nations Convention on the Rights of Persons with Disabilities, and this translates to putting people with disabilities at the heart of the services, enabling independence and choice, and supporting them to participate in life, in the life of their community, with access to the supports that they need. So to do this, we need to deliver a real step change in disability services in order to make them easier to access, more person-centred, more responsive and tailored to the individual needs of those who use them. And while the large majority of people with disabilities access services and supports through the mainstream services, funding from the department supports approximately 80,000 people who access specialist community-based disability services provided by or on behalf of the HSE. So these include services such as personal assistance, home support, day and residential, respite services, multidisciplinary therapies for children and adults, as well as community neuro-rehabilitation services. So my department, as you know, allocated €3.2 billion in funding for disability services delivered by or on behalf of the HSE. This is record funding and represents €1.2 billion increase over 2020 levels. So it does demonstrate the government's strong commitment to enacting meaningful change in specialist disability services. In 2025, €333 million in additional funding over and above the 2024 budget has been allocated. So this funding will provide for some natural demographic change in service demand and will go towards providing for the increased cost of providing services, and will also fund new developments under the Action Plan for Disability Services. In relation to your specific question, Senator, Down syndrome regression disorder, also referred to as regression, is a rare but serious disorder that occurs in some adolescents and young adults with Down syndrome. So regression is used to describe the loss of skills an individual has previously learned. So these skills can be daily living, language, movement, or social skills. The loss is often sudden, and it occurs over a period of weeks or months. So the cause of regression is thought to differ among individuals, and I understand there's ongoing research to look at causation and treatment options. So the role of the HSE is to provide a multidisciplinary team approach, which includes the provision of health and personal supports required by people with Down syndrome and Down syndrome regression disorder, and incorporates hospital, primary care and community services. It's important to note that specialist disability services are provided based on the presenting needs of an individual rather than a specific diagnosis. So services are provided following individual assessment according to that person's individual requirements and care needs. The majority of specialist disability provision, around 80%, is delivered through non-statutory sector service providers. So the HSE works in partnership with organisations, including Section 37 and 39, out of state and for-profit organisations, to ensure the best level of service possible that is provided to people with a disability, their families, and within the available resources. And one of these organisations is Down Syndrome Ireland. So this organisation has over 3,000 members and 26 branches nationwide, and provides a range of services, including early intervention and development programmes, mother and child groups, therapy services, employment opportunities, counselling and adult advocacy services. They have specialists in areas of health, speech and language, early development, education and adult education and independence that enhances the lives of thousands of children and adults with Down syndrome across the country. I'm really grateful for the work that Down Syndrome Ireland do, and I'm also proud of the role which my department plays in providing supports for people with Down syndrome and Down syndrome regressive disorder in tandem with the broader health and social care provision sector. I'm actually going to be meeting with Down Syndrome Ireland today, so I'll raise this as well with them and I suppose get feedback from them in relation to this, but I'm happy as well to engage with the HSE around this. As I say, there's research happening in this area, and look, my door is open in relation to trying to progress the access to services, particularly for people and children and adults with Down syndrome.
So it's really good to hear such a positive response because I know that, that parents and experts are saying that delays in treatment to this, if it is treated within the first 18 months, that delay of treatments can lead to irreversible, I suppose, and permanent regression in people. So, and I think just from speaking to parents, of children who are displaying symptoms of Down syndrome regression disorder are hoping that we could establish a task force, and that would encompass all the different professionals within the HSE, Down Syndrome Ireland, that will look, I suppose, that will receive the that will look to kind of see what the best pathways for children and young people to receive the required tests and acute diagnosis. And if they're not available within this jurisdiction, can opportunities become available, either private or publicly, that, through the HSE, or to look outside our borders, but that they're funded either by the Department of Health to look to see can treatment become available? Because I suppose part of the theme of Down Syndrome, or World Down Syndrome Day, was improve the support systems. And I know this is a very small cohort of people, but this is a support system that could really impact and change life, because early intervention is crucial. Thank you.
Thank you, Senator, again for raising this issue with me today. So the suite of supports which may be required of a person with Down syndrome regression disorder, they can come from across the health and the social care system, incorporating but not limited to supports from the mainstream healthcare system, such as hospital supports or primary care supports, but they may also include inputs from specialist disability services, depending on the presenting needs of the individual and the resulting appropriate care pathway. So I'm committed to ensuring that disability services are appropriately resourced to provide the support for individuals who need them. So I will raise it with Down Syndrome Ireland today, and just maybe get feedback from them in relation to their experience and lived experience on the ground in relation to this. Thank you.